Glioblastoma multiforme, glioblastoma, grade 4 astrocytoma, more commonly known as brain cancer, by Micah Martin. The definition of a glioblastoma, or more commonly known as a cancerous brain tumor, is an aggressive central nervous system tumor that forms on the supportive tissues of the brain. Other names include a grade 4 astrocytoma or a glioblastoma multiforme. The prevalence or rate of this type of tumor, according to the National Cancer Institute, there were an estimated of 23,890 cases in 2020 already, which comes out to be 1.3%. The National Cancer Institute also states there have already been 18,020 deaths this year, amounting to 3% of patients. Between the year 2010 to 2016, the 5-year relative survival rate is 32.6%. The cause or reason for occurrence is, according to the American Cancer Society, cancers can be caused by DNA changes that turn into oncogenes, which are the genes that help cells grow, divide, and stay alive, or turn off tumor-suppressing genes, which are the genes that help keep cell division under control. Researchers have found that genes that cause some rare inherited syndromes like neurofibromatosis and tuberous increase the risk of developing tumors on the brain and spinal cord. American Cancer Society reports that, other than radiation, no known lifestyle-related or environmental factors are clearly linked to brain tumors. Most gene changes are probably just random events that sometimes happen inside of a cell without having an outside cause. Some signs of brain tumors include seizures, changes in speech or hearing, vision changes, balance problems, changes in memory, personality changes, and sleep changes. Some symptoms include numbness or tingling in the arms or legs, acute or persistent headaches, difficulty walking, instability, muscle weakness, dizziness, fatigue, and vertigo, nausea or vomiting, most of the time profusely nausea or vomiting, reduced sensation of touch, and mental confusion, inability to speak or understand basic language. Some health consequences that go along with glioblastomas, there are several, and they can be just as severe as the tumor themselves. So, profuse vomiting can lead to severe dehydration due to vomiting up everything you've had to eat and drink. Inability to sleep, which causes mood changes. The inability to eat, whether it's loss of appetite or severe headaches, or the profuse vomiting can lead to starvation, and then headaches that can lead to vision changes. Some preventative measures. According to Healthline, there are several ways that brain cancers can be prevented, but here's just a couple. They recommend avoiding exposure to pesticides and insecticides, avoiding exposure to carcinogenic chemicals. They highly recommend to avoid smoking, and they especially recommend avoiding any unnecessary exposure to radiation. The most common type of treatment for a glioblastoma, regardless of location, size, stage, what type, is surgery. Sometimes only a portion of the tumor can be removed, usually due to its location. A craniotomy can be performed to open the skull and remove any of the cancerous tumor cells that are safe to go and retrieve. In some cases, the tumor is in a sensitive area of the brain, and surgery to remove it would be far too difficult to complete. These types of tumors are referred to as inoperable. Another popular treatment for not just brain cancer, but any kind of cancer in general, is chemotherapy and radiation. Patients with brain tumors may be given chemotherapy in order to destroy the cancer cells, Chemo may be received orally or by intravenous, which is an IV line. Radiation therapy is often recommended to destroy tumor tissue or cancer cells that cannot be surgically removed, like I said, whether due to location or the severity over the stage. And then radiation may be done with high energy waves like X-rays. A fun fact, not all brain tumors will respond to chemo and radiation. Some may respond to one and have a resistance for the other. The reason I chose this disease is because my dad was diagnosed with a stage 4 glioblastoma in October. And he underwent brain surgery, and he had a craniotomy. And luckily they were able to get all of his tumor out. But after surgery, they went to look at his medications and what they could put him on. And as far as chemo and radiation went, and they tested his tumor, and the type of chemo they wanted to put him on, his tumor didn't respond to. So that's where, of course we talked to the doctors about that, but that's where the fun fact came from, that not all tumors will respond to chemo and radiation. Some will have a response to one and have a resistance to the other. Another treatment is biological drugs, medication, and clinical trials. Your doctor may prescribe biological drugs to boost, direct, or restore your body's natural defense against your tumor. The doctor may prescribe medications to treat side effects of your tumor. For instance, my dad's on seizure medication and steroids to treat his swelling, to prevent seizures, and that kind of stuff. Clinical trials come into play when advanced cases of brain cancer do not respond to the other treatments. These treatments are often still in the testing phase, but are paid for by the hospital or medical institution. My dad was on a clinical trial. While he was in surgery, they injected a type of, they called it an activator, into where his tumor laid, and he was put on medication immediately following surgery. And his clinical trial was to boost his immune system so he could take his radiation treatments without getting too sick. The mortality rate for brain tumors is relatively small. According to the Brain Tumor blog, in 2018, the 5-year relative survival rate in the United States following the diagnosis of primary malignant brain tumors was only 34.9%. The 5-year relative survival rate in the United States for non-malignant, which means non-cancerous brain tumors, is only 90.47%. Effects on human performance. Glioblastomas can have a huge impact on your performance. Not only do they mess with your ability to perform on the athletic aspect, but on the physical, everyday aspect of life as well. I know for my dad, he went through mood changes and attitude changes. He was unable to, you're unable to move, you're unable to exercise because of your fatigue. You don't sleep, your medication makes it seem like you're sicker than you are. And then there are days you just can't stop throwing up. So you're unable to exercise and you're unable to perform your daily tasks. Driving, the doctors will revoke your driver's license. You will have some trouble with your emotions, and your stress levels will change. So not only does it affect your physical aspect on the athletic part of it, it also affects your everyday life as well. Your basic human performance needs, what you need to get through your everyday life. And here's all of my sources. Hope you guys enjoyed.